Yes, sorry. The Mrs. Association. Many people are there. Good evening. Hello, hello, hello. Good evening.
Good evening to everyone and welcome as we get ready to bring you live coverage of the this much talked about panel discussion organized by the Dominica Nurses Association. The nurses are celebrating their 69th anniversary. The association is celebrating its 69th anniversary, and as part of activities to mark the occasion, panel discussion tonight with nurses at the head table, experienced nurses at the head table as they get ready to deliberate this evening. We wish it could be a house full, but it's the people are coming in slowly by slowly. So let's get ready to bring you coverage of this live coverage of the panel discussion organized by the Dominican Nurses Association, beg your pardon, and that is expected to go at least until 8 o'clock tonight. So, once again, good evening and welcome aboard. You know, the nurses have been doing quite a bit for us in Dominica over the last several years, and it's quite fitting that we give them every form of support that we can possibly give them as they continue to administer care to us on a regular basis. Some know how to control their temper, their stress. Most of them do because that becomes part of their training, how to deal with persons, how to deal with the public, how to deal with patients, and how to handle emergencies. So we need to commend the nurses and thank them for their dedication and hard work over the past several years. Some have gone on before, some have retired, some have died, some have returned to the service after having served for several years. Retired nurses have gone back to the service. So now get ready to go to the podium to join the moderator.
Madam First Vice, Malika Timofija. As we begin, let us stand. We will start with the nurses' prayer. Let us stand. O Holy Spirit, fountain of light and wisdom, enlighten my understanding, removing from me all darkness of sin and ignorance. Instruct my tongue and pour out upon the grace of thy blessing. Give me quickness of understanding, capacity of retaining, ability of interpreting, facilitating in learning. Guide my going in, direct my going forward, accomplish my going forth, through Christ our Lord. Amen. We'll now acknowledge our nurses' pledge. Raise your right hand. I acknowledge that the special training I have received has prepared me as a responsible member of the community. I promise to care for the sick with all the skills I possess, no matter what their race, creed, color, political, or social status, sparing no effort to conserve life, alleviate pain, and promote health. I promise to respect at all times the dignity of the patients in my charge. I promise to hold in confidence all personal information entrusted to me. I promise to keep my knowledge and skills at a professional level and give the highest standard of nursing care to my patients. I promise to carry out intelligently and loyally medical instructions given to me. I promise that my personal life shall at all times bring credit to my profession. I promise to share the responsibility of other professionals and citizens for promoting health locally, nationally, and internationally. So help me God. Okay. Welcome again. Good evening. So let me acknowledge our special guest this evening. You all may be seated. So here we have with us this evening the Director of Primary Healthcare, Dr. Adekola Olatungunje, Principal Nursing Officer Yvette Carbon, President of the Association of Dominica Midwives, and also our evening's moderator, Miss Nurse Midwife Ifeldra James, President of the Council of Aging Inc., Mr. Nigel Lawrence, and members of the Council, President of the Dominica Police Welfare Association, Sergeant David Andrew Jr., President of the Dominica Prison Service Welfare Association, Mr. Naya Winston, President of the Dementia Association, Ms. Vernon, past and present DNA President and their executive, my fellow DNA members, staff of the media, ladies and gentlemen, good evening. So as we welcome you to this panel discussion, it is hosted by the Dominican Nurses Association. As we celebrated our 60th anniversary, we gathered under the theme, Compassion Defining Nursing Identity. Our discussion will focus on compassion as a core competence and how empathy, far from being simple of soft skill, forms the very backbone of nursing identity. As nurses, we are more than caregivers. We are advocates, listeners, and companions in some of their life's most vulnerable moments. Let tonight remind us not only of the challenges we face, but also of the extraordinary impact compassion has on the patients and communities we serve. Thank you for being here tonight. I now call on Madam Moderator.
Thank you, Madam Chair, Ms. Timothy. Good evening, everyone. Okay, as we begin our panel section for this evening, I will go over the theme again. As we heard from our Madam President during the last week, her emphasis has been on compassion throughout her speech. Those of us who were fortunate enough to join the session online last night, the educational session, we were reminded by Dr. Elwin that compassion is not simply an act of kindness. She reminded us that compassion is being able to recognize, connect, and respond. And this is the very essence of nursing identity. Tonight, as we explore the theme, we will reflect on how compassion shapes our practice, guides our ethical responsibilities, and defines the trust patients place in us. Let us consider in what ways does compassion distinguish nursing from other professions and how we can safeguard it as both a value and a skill in the evolving landscape of healthcare. So tonight we are going to hear from 5 members of our community of profession and 1 client who's going to share with us her experience. Each person, we're going to lay some ground rules. Each person will speak for 10 minutes, and I will stop you when you go for your time. Huh? Okay, and with that, I'm going to introduce each person. Online, we're supposed to be joined by our PNO, whom I haven't seen online as yet. So we will, when she comes on, we will take her as it goes. So we will begin with our first presenter. It may just disrupt the flow of things, but it's the same message we shall receive. Okay? So we will call on our first speaker, midwife Malina Olangoju. Remove the papers. Be back. Malina George Olangoju is an accomplished nursing professional currently serving as an acting public health nurse in the Roseau Health District. She holds a Bachelor of Science in Nursing with honors from the University of Derby, United Kingdom, as well as a Bachelor of Science in Midwifery with honors from the Dominica State College. As a registered nurse with extensive experience spanning acute hospital and community health, Malina is committed to maintaining the highest standards of professional practice and patient care. Her approach to nursing and public health is grounded in a strong desire to make a meaningful and lasting difference in the lives of those she serves. Rather than viewing challenges within the health system as obstacles, Malina approaches them as opportunities for transformation. She is a visionary who seeks out hidden potential, approaches complex issues with optimism, and brings the determination and resilience necessary to create sustainable improvements. Recognizing the importance of effective leadership, she continually invests in her professional growth through ongoing development and advanced leadership training. Her commitment to service extends beyond the clinical environment. Within her church, Marlena serves as a leader in both the Sunday school and the women's ministry, while also quietly supporting community and other church initiatives behind the scenes. Marlena's life reflects the many roles she embraces as a nurse, a mother, wife, and deaconess, all grounded in an active spiritual life. Her personal philosophy is simple yet profound: to treat every individual with the same compassion, respect, and dignity that she would wish for herself. Grounded firmly in her faith, Marlena lives by the belief that all things are possible, drawing her strength, purpose, and perseverance from Christ, who sustains and guides her in both her professional and personal journey. At this time, we call on Nurse Olangoju as she shared her lived experiences in patient education, emotional support, and community outreach. Let's welcome Ms. Olangoju. Leave it like that and just talk.
Pleasant good evening, everyone. It is a great pleasure to talk on such an important area, an area that is very dear to me. And what is compassion? Compassion is such a powerful word, you know. It is very powerful. And it can be so difficult to those who don't understand what it is. And tonight, my simple definition of compassion is putting yourself in another person's position. As the nurse, as a care provider, putting yourself in the position of that client that you are treating or that patient you are treating, and to get an understanding of what he or she is going through. And you don't just stop there, but it gives you that drive to go ahead and to help that client, to alleviate that fear, that confusion that you see in their eyes, to go ahead and to provide them with some reassurance, to clear any doubts that they have. Empathy and compassion, it goes hand in hand. Empathy, you take into consideration, you know, the client's feelings and their emotions. And then the compassion forces you now to do something about it. So you have the individual lying on the hospital bed. And every individual that I tell myself, every individual that I come across with, there is a story to tell. So they may have one condition or the other. That is why they are in my care. However, there is more to that person that I'm seeing. And this pushes me to get to know that individual even deeper, and then to see what can be done to help that individual. And when you speak of empathy in the nursing field, it deals with active listening. You know, for that 5 minutes or 10 minutes that that person is with you, you want them to feel that it's all about them. You provide them with that undivided attention. You let them feel that in that moment in time, they are most important. You listen to their concerns. You listen to their worries. And then you see what can be done. As a compassionate nurse, you see what can be done to help them to fix that problem, to help them to go through that experience that they are going through right now. You know, because at times, individuals, we see them smiling, really. We see them smiling. And you ask, are you okay? And human nature will say, yes, I'm okay. Because persons don't want to share the information. But when you give them that listening ear, when you provide them with that assurance, you know, they will reveal things to you that they did not even expect to reveal. So when it comes to empathy and compassion, to be an effective nurse, it's not being book smart. It's not having the highest degree. But you know, to be an effective nurse, you have to be compassionate and you have to be empathetic. Now, I have many, many experiences that I can share in terms of being an empathetic nurse and being a nurse with compassion. And I will use something very simple. For example, educating clients. In the primary care setting, that is our focus, you know, education and empowering of clients. And sometimes you have the elderly, or I would say the immigrants, the foreigners who have that little language barrier. And then, you know, I put myself in the position, especially as a foreigner. I'm in a land I'm not able to really understand the language, and I have that fear in me. And I say, how would I want somebody to treat me, being in another man's land? And so with the Haitian nationals that I'm using for my example, you know, I would try to talk the patois. I have a little challenge in talking it fluently, however, I understand it a bit better. So if I'm having any difficulty being a compassionate nurse, I will get a colleague to help interpret. Or I will go on Google. I will make use of the technology that we have. And I will go on Google Translate and type in the information and show it to them so that they can understand. Because I want, at the end of the day, any client that passes through me, I want to feel that I gave them my very best. And also in terms of something that's, you know, absent-mindedly we can do, you know, using terms that the ordinary person may not understand. Being a compassionate nurse, when you tell the client, for example, something simple as hypertension, they may look at you confused that, what is hypertension? And you pick up, being the empathetic nurse, you identify that this client did not understand what you say. And being the compassionate nurse, you go the extra mile to explain in basic terms, hypertension, high blood pressure, your blood pressure is high, you know, so that they can understand what you're saying. You also pay attention to the client's nonverbal cues. What they're saying reflecting what they're saying, is it reflecting how they really feel? You know, you prompt them to understand exactly what is going on. Because somebody may just have an elevated blood pressure reading, and you keep treating, and they say, I'm taking my medication, I'm watching what I'm eating, I have an active lifestyle. But at the end of the day, when you just sit with that client and you say, tell me what is going on. Tell me, I just want to know what is going on. And then the client opens up to you and tell you probably that their teenager is being rebellious, or they have lost their source of income, you know, their partner is having an extra affair. And then it makes you realize that, wow, okay, let me see what I can do to help empower that individual. In the community setting as well, we do outreach. And the good thing about outreach is that you get to go at the client's home. You get to see the true person. You get to see a true picture of these individuals. You get to see their vulnerabilities. And then you get to do things, to actually put a plan together, to see ways that you can assist that client or that patient or that, you know, or that family. And it is so passionate to me. It is so passionate to me. And as my philosophy, you know, do unto others as you would like them to do unto you. And many times, if we just put ourselves in the position of that individual that we are rendering care to, if we do that, our attitude, the way that we speak, the care that we give will certainly be different. It will certainly be different. And also of importance, you know, giving emotional support. You know, sometimes you don't have to say much, but a little pat on the back goes a very long way. Just your physical presence when that person gets a life-changing diagnosis, you know, when that person gets some news that they were not expecting. Just your physical presence, not busy on your phone or anything, just being there, letting them know that I am here for you. If you need me, I am here. You know, this makes a huge difference. And I thank God for the opportunity, you know, to be that compassionate nurse, and to be that nurse that is empathetic, and to actually see persons, for who they are. It's not about their background or their status. Every client that I encounter, I treat them equal. I treat them equal. And I want everybody to feel that, they matter. They matter. Who really wants to be dependent on anybody else? Everybody loves freedom. Everybody likes to move about and make their own choices. And when they are sick, they don't have a choice. They come to us. And when they come to us, they're expecting that professionalism, they're expecting to feel that when they leave your presence, a load is lifted off of them. And this is what I try to do on a daily basis, When persons leave my presence, I know that, yes, I did what I'm supposed to. When I lie on my bed at night, because this helps me also to know that, okay, did I do a good job, Because reflection is very important to me. That at the end of the day, when I go to bed, I reflect of the encounters that I've had with persons. And then I will say, am I feeling satisfied? The care that I gave, the words that I spoke, did I make a difference in that person's life? And the difference that I made, was it a positive, lasting impact, or was it a negative one? And as long as, I know that, yes, I made a positive impact in that person's life, it really motivates me to continue to do more and to be, that patient advocate that I can at all times. So thank you, and I look forward to further discussions on the platform. Thank you.
Thank you, Ms. George, for that perspective. How many of us can say we are halfway like Ms. George, or we want to be like Ms. Olangoju? You there? Okay. So then, yes. This is something for those of us who lagging behind. We can strive to improve on ourselves and our practice. Okay? Building on the idea of compassion as a guiding principle, I'm now going to invite our next speaker, who is not from our nursing realm, but has interacted with us in a setting that she can give her testimony about. Okay? And just before I give her biography, I just want to inform the speakers that they're being timed by Madam First Vice. So when you're halfway through, she'll put up her little tag, and when you get her at the end, she'll put up her tag again. Okay, this evening we are happy to welcome Mrs. Diane Stout Abraham. She's a wife, a mother of two, and an agricultural professional who serves as head of the Plant Protection and Quarantine Unit within the Ministry of Agriculture, Fisheries, Blue and Green Economy. Her connection to compassionate nursing care is deeply personal. Her son Zion Abraham was born extremely premature at just 26 weeks gestation at the Dominica China Friendship Hospital, beginning a challenging journey that required intensive neonatal care. Throughout Zion's hospitalization, Mrs. Stout Abraham experienced firsthand the vital role nurses played not only in providing specialized clinical care to her premature infant, but also in offering compassion, reassurance, encouragement, and support to her as a mother. This experience has given her a profound appreciation for the nursing profession and the lasting impact that empathy and compassionate care can have beyond clinical outcomes. She joins the panel to share Zion's journey through the eyes of a mother, and to offer a family's perspective on the difference compassionate nursing care can make in the lives of patients and their families. Please welcome Mrs. Diane Stout Abraham.
Good evening to everybody. Protocol has been established.
Let me say thank you to the organizers for inviting me to this very important panel discussion. I really do appreciate it. So this evening, I was asked to speak on the impact on patient outcome, evidence linking compassion to recovery, satisfaction, and trust, provide insights into how nursing care impacts quality of life beyond clinical measures. So this evening, again, I stand here before y'all as a mother. My son, Zion Abraham, was born extremely premature right here at the Dominica China Friendship Hospital at only 26 weeks. So nothing truly prepares you for having a baby at 26 weeks. Instead of taking your baby home, you find yourself entering the unfamiliar world of neonatal intensive care, of course, to include incubators, monitors, alarms, oxygen, medical terminology that you don't understand, as you watch the numbers on a screen without always knowing what they mean. You listen to conversations filled with terminology you have never heard before, and sometimes you're simply afraid. So it was during that journey that I came to understand that compassionate nursing care is not separate from quality health care. It is an essential part of the journey. Zion needed specialized medical and nursing care. That clinical competence was essential, but I remember just as vividly is how the nurses made me feel while they were caring for him. They explained medical terminology that I did not understand. They answered my questions and gave me advice. They reassured me when I was uncertain. Some of the nurses, they prayed with me. They encouraged me to go home and rest because they understood that I needed the strength. And sometimes they deliberately spoke to me about things that had absolutely nothing to do with Zion. At first, that might sound insignificant, but it wasn't. Because when your mind is consumed every day with whether your baby is going to be okay, sometimes someone engaging you in an ordinary conversation gives your mind permission. Thank you. And even for a few minutes, it allows you to breathe. I recall that some of the nurses would bring snacks for me. Hot teas, hot cocoa tea. Nurse Regis, thank you. I remember that while at the hospital, I spent my birthday, and that morning, Nurse Mills brought the most delicious breakfast for me. Thank you. One of the challenges of having a tiny premature baby is that initially, you can be afraid to do almost anything because he looks so fragile. But the nurses, they didn't simply care for Zion while I stood and watched. They helped me become involved. They showed me how to change his tiny diaper while in the incubator. And I vividly recall Nurse Ansem, thank you for teaching me. They encouraged kangaroo care, allowing me to hold him against my chest and experience that connection between mother and baby despite all the equipment surrounding him. They encouraged me to help to talk to him
and to sing to him as well. And there were moments when I emotionally couldn't do it because it was just so much. And I recall Nurse Mills helping me to sing and helping me to pray. These moments reminded me that underneath the wires, monitors, and medical intervention was still my baby, and I was still his mother. This is an aspect of nursing care that cannot easily be measured. They wasn't only helping to care for Zion, they were building my confidence and empowering me to care for my child. When your child is critically vulnerable, you are placing someone to love or trusting someone to love them more than anything into the hands that you might have not known before. And this is extremely important. I see the time is up. Okay, thank you. But when someone listened to my concerns of dismissing them, my trust grew. And I was encouraged. When I was encouraged to participate in his care, my trust grew. When I realized that the nurses saw Zion as a little human being and me as his frightened mother, not simple as another patient or another parent, trust grew. When we discuss patient outcomes, understandably we think about measurable things. We think of vital signs, we think of weight gain, we think of oxygen, we think of test results, and all these are important, but my experience taught me that other outcomes that may not appear on a patient's chart is important. A mother's confidence in caring for her baby is an outcome. Bonding between a parent and child is important. Feeling informed rather than helpless matters. Being emotionally supported through a traumatic experience matters. And preparing a parent to confidently care for that child after discharge matters. Compassion does not replace clinical competence. These two should complement each other. Excellent nursing care treats the medical condition. Compassionate nursing care recognizes human being experiencing it. Today, when I look at Zion and see how far he has come, I naturally remember the medical care that sustained him during those very vulnerable early days. But I also remember the people that cared for him. I remember the nurses who prayed with me, Nurse Mills, Laurel, as well as Garcia. Muchas gracias. I remember the encouragement, Sister James, God bless you, thank you. I remember being told to get some rest. Nurse Roy, thank you. Nurse Favre, Nurse Thomas, thank you. I remember the conversations that helped me distract me when my mind needed a break. Nurse Valmont, thank you. I remember being taught how to change a tiny diaper through the incubator. Nurse Ansem, thank you. I remember the explanations that I didn't understand. Nurse Elise, very fluent, thank you. I remember being encouraged to use my voice to comfort my baby, even when I struggled to find that voice myself. Nurse Jeremy, Nurse Joseph, Nurse Mills, thank you. A nurse may perform hundreds of acts of kindness throughout his or her career and may eventually forget some of them, but this I will always remember. I vividly remember the little encouragement in the rooms, in the corner of my room. Nurse Wilkins would come in and say, "You're such a good mother. Continue. Thank you." We remember how you treated us when we were frightened. We remember who took the extra minute to explain. Nurse Fagan, such a darling, thank you. We remember who encouraged us when we were losing hope. And we remember the people who made an unfamiliar and frightening environment just a safer place. So when I am asked what compassionate nursing care means to me, and my answer is simple. It is caring for the person, not only treating the patient. It is clinically competence accompanied by empathy, communication, patience, dignity, human connection, identifying that the persons need comfort, help. Zion may have been the patient, but during our journey, the nurses, they cared both for myself and my son. They cared for his clinical needs while helping me find the strength and confidence to be his mother in an environment that was frightening and unfamiliar. For that, I will forever be grateful. And the nurses here this evening, I would simply say, never underestimate the impact of the small things that you do. The procedure may eventually be forgotten, the terminology you might not remember. But very often, how you made a patient or family feel during one of the most vulnerable moments of their lives will remain with them long after they leave the hospital. Thank you.
What a testimony. Yeah? Okay, so hats off to our neonatal team. Let's give them a round of applause. Yeah. And we heard the recurring theme that has been preaching for the last week or two. It is not the giving medication. It's not just what you do. It is how you make the person feel. And we heard that coming strongly through this presentation tonight. So I just want to encourage all of us that as we continue our journey, we want to be at least a quarter way like the NICU team. We will try beginning tonight, tomorrow when we go to work. Let's just start putting our best foot forward. Because some of us, we feel good when people speak about us and say about the good things we do, right? But we also feel terrible when they say the bad things that we do. So we want to eliminate the negative and keep promoting the positives. All right? Thank you again, Mrs. Abraham. I see we have PNO is online and she's supposed to be doing her contribution. So let's see if we can facilitate her at this time. In the meantime, I will read her biography. Yvonette Anatole Carbon, Principal Nursing Officer. Yvonette Anatole Carbon is an accomplished nursing professional and public health practitioner with over 2 decades of experience in nursing, midwifery, and community health and public health. Her career reflects a strong commitment to advancing healthcare services and improving the health and well-being of communities. Mrs. Carbon began her nursing career in 2001 after completing her certificate in registered nursing at the then Princess Margaret School of Nursing. She subsequently obtained a certificate in midwifery in 2010 and a bachelor's of nursing from the University of the West Indies in the same year. In 2018, she further advanced her professional development by earning a master's of public health from the Southern Medical University in China. Her professional journey has included service as a registered nurse at the Princess Margaret Hospital from 2001 to 2007, and at the Reginald Fitzroy Armour Hospital from 2008 to 2010. From 2010 to 2016, she served as a district nurse at the Clifton Health Center, followed by several years in public health nursing. From 2019 to 2024, she served as a public health nurse, and in 2025, she assumed the role of senior public health nurse for Region 2, an expanded program on immunization manager. In her role as expanded program immunization manager, Mrs. Carbon demonstrated notable leadership in strengthening national immunization efforts. She was instrumental in securing sponsorship from the organizations including UNICEF and PAHO for the development of a mural in the Taru area. She also helped promote increased national vaccination coverage by securing broad television and radio media coverage to raise public awareness about vaccination. During her tenure as a public health nurse, her district received the recognition of most consistent district during the COVID-19 pandemic, reflecting her dedication, leadership, and commitment to maintaining quality public health services during a challenging period. Mrs. Carbon currently serves as the principal nursing officer, where she continues to contribute her extensive knowledge, experience, and leadership to the nursing profession and the wider healthcare system. Beyond her professional accomplishments, Mrs. Carbon is married and is the proud mother of 2 children. Her career exemplifies dedication to nursing, public health, leadership, and service to country. Let's just see if we can facilitate her at this time. Hang on 2 minutes. Who is supposed to show, but it has to be up here for her to see her. She's on? She's supposed to be on. Does it have to be up here so I can turn off the mic?
Just exercise some patience with us as we work with the nurses on the observance of their anniversary they are celebrating. We are broadcasting from the auditorium of the Dominica China Friendship Hospital in Goodwill, and we're standing by to join Yvonne Anatole remotely using technology. She gets ready to address this panel discussion tonight. As a result of this broadcast, we're hoping that we can end by 8:30, but just to let you know that we won't be able to bring you a live edition of Real Talk with Carido Ghost Williams. We want to wish Mr. Clarence Christian a speedy recovery, and the Ghost, we want to wish you all the best, okay? And thanks to you, Carido Ghost Williams and Clarence, for allowing the broadcast to go right through. Real Talk with Carido Ghost Williams. We want to wish
I can hear some talking in the background. Where is that from? Is it from me or from somebody else? Okay. Okay, so give me a minute, because when I was not hearing anything, I went on YouTube. Some talking in the background. Where is... Okay. Can we still hear the talking in the background? Yeah, I just turned it off. Okay, good evening, everyone. And thanks for the opportunity, giving me the opportunity to share during our 69th anniversary celebration. I take it as a real privilege. Can I start sharing my screen? Okay, there we go. Can you all see my screen? Okay, but I have a strip. Okay, it's getting off. Okay, good. Nice. Okay, so I have been charged with the responsibility tonight to discuss professional identity, advocacy, and leadership shaping healthcare policy. I will try my best to do some justice to the topic. My slide is not moving. I don't know why. I tried everything today and it worked perfectly. Okay, great. There we go now. Okay, so professional identity, advocacy, and leadership are all closely related concepts that shape how healthcare professionals engage in the development and implementation of healthcare policy. So, what is professional identity? So, it is the way that healthcare professionals understand their roles, responsibilities, values, knowledge, and ethical obligations within the healthcare system. So, as healthcare professionals, we have an ethical responsibility. We have values that we need to upkeep as a profession. So, all those are things that will help to identify us as a profession. So it is developed through education and professional training. So when you are trained as a nurse, you cannot just decide, okay, I am trained as an RN and it ends there. So you should continue to grow professionally. It also is gained through clinical experiences. So from your years of service from working, you are going to have professional or gain professional identity through that, through our professional code of ethics, the relationships that we maintain with our patients, our colleagues, and the communities we serve. Also, our membership in our professional organizations. And I will pause here a bit because a lot of times when you ask young nurses or even nurses on a whole to be part of the professional organizations, the first comment you will hear them say is, what is it that DNA is doing for me? But here we can see it is part of, if we want to develop our professional identity, it is good that we be part of our professional organization. As well, it is developed through continuing professional development again. So, strong professional identity encourages healthcare workers. So, it encourages us healthcare workers not just to see ourselves as direct providers of care, but also as advocates for our patients, the communities we serve, and improvements in our healthcare system. So, you see, it is very important for us as nurses that we have a strong sense of professional identity. Then if we look at advocacy, what does advocacy mean? Advocacy involves speaking or acting in support of individual groups or issues that require our attention or change. And a lot of times as nurses, you will hear us say, I need to advocate on behalf of my patient. The doctor may order a treatment, and in your professional capacity as the nurse, you may figure out this may not be the best course of treatment or the best plan of action to aid in the client's recovery or patient's recovery. So you will often hear nurses say, I need to advocate on behalf of my patients. And that is where nurses, that is what we should do. So as healthcare professionals, we can advocate at different levels. So we can do it at the patient level for those of us who are doing the bedside nursing. We can do it at an organizational level for those of us in policy making decision at management level. We can also do it at the community level for those of us who serve on the district level and also nationally and at international levels. So there is no boundary when it comes to advocacy. Healthcare advocacy can also include identifying problems affecting patients and our communities. So it goes further than just advocating just for your patients. So go out in the communities and see what are the problems that are affecting the clients. It involves educating policymakers about healthcare concerns, participating in professional organizations, and writing letters or policy briefs. So all that includes advocacy. We can also do it by giving testimony at public meetings. We can do it by supporting the legislation that improve health outcomes, educating the public about health issues. A lot of times the public, they may not even be aware of what is going on, and they depend on rumors and hearsay. So as healthcare providers, as advocates, it should be our responsibility to go out there and educate the public so they can know, and in turn it will help them to make informed decisions. We can also use evidence and patient experience to influence decision making. So nursing is about evidence-based decision. So when you bring forth a proposal, you should have your evidence to support it, evidence to back it up. And advocacy is particularly important because healthcare professionals, we have first-hand knowledge of how policy affects patients and the delivery of our healthcare. So because of that, advocacy is of high importance to us because we have the first-hand knowledge of whatever is going on in the healthcare system. Then we're going to take a look at leadership. And I took a quote from Bill Gates where he said that leadership is not about being the best. It is about making everyone else better. So we should not just strive to be good leaders, but we should try to make everyone else better. And then in the process, it makes you a better leader. So leadership in healthcare is the ability to influence, guide, and motivate others toward better health outcomes and improvements in our healthcare systems. And even before I came here this evening, I was at a meeting and that was some of the things that we were discussing. So we need to motivate others. We need to bring ideas to the table that can help to improve the healthcare system so that we can have better patient outcomes, because that is what we are all striving towards. So leadership does not require someone to hold a formal management position. And a lot of times you will hear comments that the nurses will say, oh, but I am not the supervisor. So you do not necessarily have to be the supervisor in order to take on a leadership role. A healthcare professional can demonstrate leadership by identifying a problem and helping others develop a solution. So a lot of times we may go to our managers and we will say, oh sister, this is the problem that we are experiencing. Piano, this is the problem I have. But yes, it is fine that you have identified the problem, but have you also identified any solution to the problem? And I often say to people, it's two things in life. You're either a part of the solution or you're a part of the problem. So leadership does not require you to hold a formal management position. So we are all leaders in our own rights. You observe something is not going right in your particular area of work. You identify the problem. You can go to your supervisor and say, sister or matron, this is what I have recognized on my unit. These are the deficiencies I have identified. And I think those are some of the solutions that we can use. So you identify problems and you help to develop a solution. So effective leaders communicate clearly. You have to be able to communicate clearly as a leader. When you give instructions or directions, the person that you have given it to should not be left wondering, what is it that I must do? They must have clear instructions. And a lot of times we do not get things done the way that we want them done. Why? Because we did not give clear instructions. We did not communicate clearly. And then we expect the person to whom we are giving the instructions to know what is it we want them to do. But we cannot expect them to know what is it we want them to do. So we have to be able to communicate clearly. And we need to be able to use evidence to support our decisions. So a lot of times you will hear the staff say, we need more nurses, we need more staff, we need more staff. But where is the evidence to support that you need more staff? We need to also, a good and effective leader should collaborate with other health professionals because nobody knows it all. No matter how smart we are, no matter how intelligent we are, you cannot know everything. So it is good that we can collaborate with other professionals. We need to promote ethical practice. Ethics is very important. What is it that I do and I say when nobody's watching? And I enjoyed the conversation last night. We need to be able to understand the needs of patients and communities, because when we understand the needs of our patients and our community, it will help us to plan effectively. It will help us to plan towards to meet their needs. When we plan, when we understand their needs, we need to encourage innovation. Something that worked 10 years ago, will it still work now? We have emergence of new diseases, we have new equipments and machinery. So the things that we used back then may not necessarily work. We also need to address health inequities and to participate in policy discussions and decision makings. So do not just sit on the back burner and say, oh, so they're not saying that is what they should do. Yes, but what is it that am I doing to help to resolve what is going on? And one may ask, how do all these things, how does these things shape policy? What does that have to do with policy? What business does it have to do with policy? So they all work together because a strong professional identity helps a healthcare professional to recognize important issues. Advocacy provides a means of communicating these concerns, while leadership, on the other hand, mobilizes others and turns concerns into meaningful actions. So you see how they work hand in hand. So after we advocate, we talk to the doctor. Doctor, don't you think if we use this medication, we will have a better outcome for the patient? I can wrap up in 1 minute. Okay, thank you. Okay, thank you. So I will go to my summary. So professional identity gives healthcare workers a sense of responsibility and ethical direction, whereas advocacy gives them a means of speaking up for patients and improve healthcare. Leadership, on the other hand, provides the ability to mobilize people and influence decisions. And when combined, these roles allow healthcare professionals to become active participants, not merely recipients, in the development and implementation of healthcare policy. I thank you.
Thank you for your insight and your perspective from a policy point of view. And what we are reminded of, or we can do a small takeaway in what we were, Nurse Anatole has just informed us, that compassion goes towards the staff as well. If we are compassionate to each other, we recognize what is going on with somebody else, we pull them up, and it's not a competition to say I'm the best nurse on the unit, but we want everybody to be the best nurse on the unit. And by so doing, we improve our profession, okay? Right, so it seems so many tidbits we get in for us to start from tonight. From a managerial point of view, we also continue in this light, and we introduce Deborah Philip Roach, who is going to be our next speaker. Deborah Roach Philip, sorry, I mix your name up like a soup. Deborah Roach Philip is a nurse manager at the DCHF for the past 8 years and working in nursing administration for the past 15. She worked as a district nurse immediately after graduating from the School of Nursing for 9 years and a midwife from 1996. Deborah Roach Philip is a recipient of an executive diploma in management from the University of the West Indies in 2007 and graduated from the Dominica State College with a BSN in nursing, from the first ever cohort of nurses who pursued that training in 2010. She's an active member of her nursing professional body, the Dominica Nurses Association, and served as president for 2 consecutive terms and served in several other capacities. During her tenure as president, nurse manager Roach Philip instituted the Elaine Pringle Award in honor of the last living founding executive member of the association. She served as the regional director of the Caribbean Nurses Organization for 2 consecutive terms and was the recipient of the Mavis Haney Award of Excellence for Outstanding Clinical Nurse Practice in 2016. Nurse Roach Philip also is a recipient of the Award of Outstanding Nursing Ethics and Professionalism from the General Nursing Council in 2024. She was the coordinator for the first ever nursing mentorship program of the hospital, an initiative of the former principal nursing officer, Mrs. Cesarina Ferrell. She has been an executive member of the Dominica Public Service Union for the past 2.5 years and served on the disciplinary committee of the General Nursing Council. Nurse Midwife Roach Philip is presently the coordinator of the DCHF In-Service Committee. She has served her country with dignity and respect in the field of nursing for the past 33 years and pledged to continue to deliver the best quality of service to the people, no matter their race, their color, political or social status, and to leave a legacy of excellence upon her transition. Let's welcome Ms. Deborah Roach Philip.
Thank you, Madam Moderator. A pleasant evening to Madam President, Ms. Joanna Blaise, and the executive members of our professional organization, my colleagues on the panel, Madam Moderator, participants and listeners. It gives me great pleasure to deliberate on this topic at this momentous occasion when the Dominican Nurses Association is celebrating such milestone, 69 years of existence, under the theme, Compassion, Defining Nursing Identity. Nursing void of compassion is an oxymoron. Hence the reason why the topic states compassion as the core competence and how empathy defines nursing. I want to take some time to define some keywords to bring clarity to what nursing is all about. I'm going to break down the word compassion. The prefix com means with, together, in association, or act as an intensive to mean completely. Passion means a very powerful and intense emotion, such as a deep love, strong enthusiasm, or fierce desire for something or someone. So we can clearly say compassion is with complete passion, which is with complete enthusiasm. We would say in our local parlance, I'm that. If you have compassion for something, you say, I'm that. Or, I am in it, body, soul, and spirit. Or another terminology we would use, like pig loves mud. That is how deep the compassion is. Let me now define compassion as Google says. Compassion is the feeling of deep sympathy and sorrow for another person's suffering or bad luck, paired with a strong wish and drive to help make it better. The word comes from Latin roots meaning to suffer with. I'm going to define compassion in nursing. Compassion in nursing is the ability to recognize a patient's physical pain or emotional distress, feel a genuine emotional resonance with their struggle, and take purposeful action to help relieve it. It goes beyond basic clinical tasks by treating patients with deep human dignity, respect, and active empathy. And I want to take some time to define empathy. Empathy means stepping into another person's shoe to understand and share their emotions. And I reiterate, share their emotions from their point of view. And I also want to define sympathy. These are terms that we use in nursing in our profession. Sympathy means feeling pity or sorrow for someone's hardship from an outside perspective. So sometimes we use sympathy and empathy interchangeably, but there is a difference in the two. With sympathy, you observe the pain the person is going through, whereas with empathy, you feel alongside the persons. Like myself, whenever I go to a funeral and people cry, I feel their pain and tears just run down my cheeks. Empathy drives nurses to go beyond their call of duty to ensure the well-being of all their patients. When I say all, I mean the vulnerable, the challenged, the rich, the poor, the abandoned, the young, the elderly, the educated, the illiterate, the gentle, and the hostile as well, the arrogant, the brave, the fearful, the first class, and the second class. Now I want to take some time to define core competence. And all this is talking about what it is we are here to discuss. Core competence are the main strengths or the special skills or deep knowledge that a person or a company does best. So compassion, when you hear the word compassion, you should know the best place you can receive compassion is to be a patient or to be in the care of a nurse. The best ever. They give a clear edge over others and real value and are hard to copy. That's why people before used to wish they are nurses, because there is something unique about nurses and nursing. Examples of what empathy is displayed in treating patients with dementia. And there is somebody here who is associated with dementia. I would like to speak to you after this discussion, because we all know it is not an easy task, but nurses have to deal with that. The mentally ill. The young man in traction who is up and about and he broke his leg and he has to lie on his back for how long? It's not easy. Compassion makes the nurse do it and do it best. A patient in labor with low pain threshold and has no significant other present in the labor room. The nurse has to be the boyfriend, the husband, the parent, the loved one near that person. A discharged patient with no home to return to and no family support is in the care of the nurses. I have only 5 more minutes. I want to quickly go into a bit of history, because we need the history to really let us see where nursing comes. Throughout the pages of recorded history, nursing has been integrated into every facet of life. A legacy of human caring was initiated when, according to the book of Exodus, so since in the Bible time, 2 midwives, again, midwives, like myself, Shipra and Pua, rescued the baby Moses and hid him to save his life. They broke the law, but the heart of compassion would not allow them to give up Moses to be killed. According to Sherry and Jacob, 2008, Florence Nightingale, we all know about, from an early age, she demonstrated a deep concern for the poor and suffering. At the age of 25, she became interested in training as a nurse. However, her family was strongly opposed to this choice and preferred that she marry and take her place in society. However, in 1851, her parents finally permitted her to pursue training as a nurse. The outbreak of the Crimean War marked a turning point in Nightingale's career. Nightingale and her team of 38 nurses were assigned to the barracks hospital at Scutari. When she arrived at the barracks hospital, she found deplorable conditions. Between 3,000 and 4,000 sick and wounded men were packed into the hospital, which was originally designated to accommodate 1,700. So you can imagine. There were no beds, no blankets, no food, no medicine. Many of the wounded soldiers were placed on the bare floor, where lice, maggots, vermin, rodents, and blood covered their bodies. There were no candles or lanterns. All medical care had to be rendered during the daylight. But despite the distressing conditions at the barracks hospital, the army physicians and surgeons at first refused Nightingale's assistance. Some of us, if we were in Nightingale's place, we would have just given up. But this lady had a heart of compassion, which all of us should be emulating. However, within a week, faced with scurvy, starvation, dysentery, and the eruption of more fighting, the physicians, in desperation, called on Florence Nightingale for help. She immediately purchased medical supplies, food, linen, and hospital equipment using her own funds and that of the Times Relief Funds. Within 10 days, she set up a kitchen for special diets, had a laundry building set up. She hired the wives of the soldiers to manage it. Weeks later, she initiated social services, reading classes, and even coffee houses where soldiers could enjoy music and recreation. She spent up to 20 hours each day caring for wounds, comforting soldiers, assisting in surgery, directing staff, and keeping records. Isn't that compassion at its best? So I am here. I have a lot more to talk about that I will try to disseminate later as we discussed. Thank you. I needed
30. Okay. Thank you, Sister Philip. And is that not the same as it is today, as it was with Florence Nightingale? We still have no beds, no equipment, no this, no that. Yet, we all should be all in. We give the very best that we could, or we can, sorry, which is service, empathy, sympathy with compassion. Okay? It's not as bad, yes, it's improving, but we still say, it haven't got this, it haven't got that. But despite that, we can give the care that we need, like the NICU team. Okay, our final speaker for tonight is by no means least. We're going to hear from Miss Mignon Roll-Shillingford, Health Promotion Specialist. Mignon Roll-Shillingford is a highly accomplished nursing professional with more than 25 years of experience as a registered nurse. Throughout her distinguished career, she has demonstrated a strong commitment to nursing, health promotion, education, mentorship, and the advancement of healthcare in Dominica. She holds a Bachelor of Degree in Nursing and a Master's degree in Education in Health Promotion, with specialized expertise in health promotion and behavioral change. Her professional interests and advocacy have practically focused on non-communicable diseases, prevention, and management, where she continues to champion healthier lifestyles and improve health outcomes. Mrs. Roll-Shillingford has held several significant leadership and professional positions. She is the past president of the Dominica Nurses Association and previously served as assistant treasurer of the Caribbean Nurses Organization. She also served as a clinical instructor at the Dominica State College within the Faculty of Health Sciences, contributing to the education and development of future health nursing professionals. Her commitment to nursing profession extended to her service as a member on the National Nursing Council. She currently serves as a coordinator of the Health Promotion Unit within the Ministry of Health, Wellness, and Social Services, where she continues to use her knowledge, experience, and passion to promote healthier communities and strengthen health promotion initiatives. Beyond her professional life, Mignon is a woman of many talents and passions. She's the creative force behind Chef Mignon's Kitchen, where her love for culinary arts and social media comes together. She's also a passionate Calypso lover and Calypso Judges coordinator, reflecting her appreciation for Dominican's vibrant culture and artistic traditions. At the heart of all these accomplishments, is a woman who values relationships, service, and professional connection. She's a wife, lover, mentor, educator, advocate, and professional whose multifaceted journey continues to inspire those around her. Mignon Roll-Shillingford's life and career represents a powerful blend of professional excellence, leadership, health advocacy, creativity, culture, and mentorship. Let's welcome Ms. Mignon Shillingford to the microphone.
Good evening, everyone. Good evening. Let me take this moment to acknowledge in our midst the president of the Dominican Nurses Association, Mrs. Joanna Loa Brez, past presidents. I see Sister Ophelia Linton here, one of my mentors. I would like to acknowledge all the different representing groups, those online, the other members of the Dominican Nurses Association executive, my fellow panelists. I'm not forgetting our director of primary health care, Dr. Ola. I'm not going to bite my tongue with the rest. And also to those of you who are logged on the Zoom link, Kyrie FM, the media, and also GIS. I want to thank you very much for being here. First, let me go off track just 1 second and acknowledge the presence of one of my past students. I call her my daughter, who is sitting at the head table with me, Mrs. George Ola Gunju. And of course, my nose was growing, because what I did as the clinical instructor, I led them with compassionate instructorship. Okay, so when you are compassionate in everything that you do, your subjects, the persons that you care for, they thrive and they do well. So as a health promotion specialist, I've learned that the greatest expression of care may sometimes be preventing illness before the person ever becomes a patient. Now, nursing identity extends far beyond the bedside. And of course, I may reiterate some of what my other panelists have mentioned. The nurse as a health promotion champion. We can't only care for people when they are sick. Do you agree? We must also ask, why did they become sick? What risk can we prevent? What knowledge can empower them? What social factors are affecting this health? Nurses have opportunities to promote healthy eating, physical activity, mental well-being, sexual and reproductive health, immunization, screening and early detection of diseases, NCD prevention, infection prevention, healthy aging. I see members of our healthy aging community present. Environmental health. Research has found that relationships between nurses, health promoting behaviors, compassion, satisfaction, compassion fatigue, burnout, and reinforcing that nurses' well-being is connected. Now, let's look at every nurse, the fact that every nurse is an educator. We learned that in school, right? Every interaction is an opportunity for health promotion. We agree? And that's why at Health Promotion Department, we always say that health promotion is a strategy and not a program. So within all nursing activities and other medical fields, there must be an area of health promotion. So, a patient comes to us for blood pressure check. And what do? We screen, we listen, we identify the risk, we educate, we motivate, and then we refer, and then follow up. So there's a transformation from patient to partner information, understanding, advice, empowerment, treatment, prevention. Health promotion is compassion expressed before illness becomes a crisis. So let's look now in terms of from individual care to community resilience. As nurses, our responsibility does not stop at the hospital or clinic door, and I think Mrs. Ola mentioned that. We can help communities to, one, prepare, know their risk, prevent, reduce avoidable diseases, respond, act during emergencies, adapt, cope with changing health threats, recover, rebuild after crisis, and of course, to thrive. There's a saying I always use that I will not just survive, I will thrive. Becoming healthier and more resilient, recent nursing literature on COVID identified that during the COVID pandemic, yes, nurses were able to help in community resilience, advocacy, while emphasizing that staff well-being is essential in sustaining these functions. So now we're going to look at the compassion challenge of nurses and how is it and why it is important that we as nurses have to have self-compassion. So, compassion challenge. But what happens when the caregiver becomes exhausted? Nurses give compassion, we give knowledge, we give time, energy, emotional support, and clinical expertise. But sometimes we forget to ask, how is the nurse? Burnout and compassion fatigue can affect well-being, professional commitment, retention, and the quality and safety of care. So, let's talk about self-care, which is not selfish. Do you know that? A compassionate nurse must also practice self-compassion. How can we do that? First, stop. Recognize when you are overwhelmed. Breathe. Create moments to pause and to reset. Connect. Talk to colleagues, mentors, or trusted persons. Set boundaries. You cannot be everything to everyone. Rest. Recovery is part of professional performance. Reflect. Ask, what am I carrying that I need to put down? But self-care cannot be the nurse's responsibility alone. Do you believe that? This is an important part for a panel discussion. We cannot tell nurses, take care of yourself, while giving them excessive workload. Inadequate staffing, poor resources, limited support, unsafe environments, and little recognition. All of this is needed to be compassionate. So, I want to leave a message, and I'm rushing because I saw the paper went up. I want to leave a message to the next generation of nurses. As someone who has experienced nursing from the perspective of student, nurse, educator, health promotion, practitioner, my message is, never lose the person behind the patient. Learn your science. Master your skill. Use evidence. Advocate. Teach. Prevent. Promote health. Build resilient communities, but never lose compassion, because patients may never forget the procedure. They may forget the medication. They may forget what you said, but they may never forget how you made them feel. Thank you.
Well, well, well. What a fitting circle, eh? Because we ended just the same way we started. Wasn't that so? Okay. We heard from nurse and midwife Olangoju, who explained how compassion influences one career. Mrs. Abraham gave us a powerful reflection. Nurse Anatole PNO highlighted the ethical dilemmas. Then came along Roach Phillip, who gave it to us from a management perspective. And here we are, ending where we started, to stop, recognize, and act. Self-reflection and the heart of compassion. What an evening. We want to say thank you to all the panelists. And before we interact with you, the audience, Madam Sec, we're supposed to have. Right. My mic is off. At this time, do we have any comments, questions from you, the audience? We will entertain you for the next 30 minutes, I believe. Is that so? Yes, let's hear you. Anybody who have 20 minutes? Okay, no problem. Anybody have any questions, concerns for the panelists at the table? We will pass around with a mic so you could ask your questions and you don't have to really come up. Yes, we have Miss Shirley at the back there.
Thanks ever so much to everybody. I just wanted to ask, how old was Zion when he was born? And how old is he now?
You. Mm-hmm.
So, I think I can speak loud.
Yes.
Can you hear me?
Mm-hmm.
Yes. So, okay.
This one. You can take this one off. No? Okay. Okay, come.
So Zion was born at only 26 weeks old, and right now he's 1 year old and will be 1 year corrected age in October. So basically he's like 9 months? No. Yes, how about that? 26 weeks. Yes, yes. But he's doing good. So far, no complications. Praise God.
Okay, is there anyone else who would like to say something or ask a question? Okay. Oh.
Good night, Antonia from the Dominica Diabetes Association. To Mrs. Roll, thank you everyone for the information that you shared and the passion that it was shared with. Mrs. Roll caught me because she said things that went beyond just the nursing when she said self-compassion. And she did not just speak to nurses, but I think she spoke to mothers and she spoke to teachers and she spoke to somebody whose life is kind of a hustle. The question to Nurse Roll and to the other panelists, what happens when you're caught between compassion for self and compassion for a patient and you have to choose? So what happens when you're caught between, I need that moment for me, and somebody needs you to give them that moment for them?
You got that, Nurse?
Okay, so I'm going to ask the question again. Compassion was spoken throughout the night. And for Mrs. Rowe, she kind of coined everything and she spoke to beyond the nursing, she spoke to us as mothers. So the question is, what happens when you're caught between self-compassion, when I need to make that decision between a moment for me and I need to breathe, or there's a need for somebody before me that needs compassion from me? So how do you make that decision? Where do you draw the line? What do you do when you need it for you, but you also see the need for it in a patient, in somebody before you?
This question was directed at Mrs. Rule, right? Or any of the panelists. Okay, thank you.
Okay, so I would approach this question in this way, because sometimes I have been overwhelmed with being in a position where I had to be compassionate with a client or a situation. It could be client, it could have been staff as well, and I needed to be with myself. I think it's deciding what is priority at the time. And there can only be one priority. Right, Sister Linton? There can only be one priority. And if you are not in the position to be compassionate, you can mess up things. You can end up being more harmful than good. And that is a situation sometimes that happens a lot with us nurses when we work on a particular ward and we may feel tired or overwhelmed. We may not have a physical tiredness, but an emotional one. And we are short-staffed. And we think of our colleagues that have been working effortlessly and need to break. And we think being compassionate means we need to go and relieve our nurse. But we are not feeling, we need some self-compassion, right? Going into the clinical area, you know the risk that can happen when you are tired or overwhelmed, errors in medicine. So in that area, when you think of put compassion first for the institution, your colleagues, the patient, and not yourself, then you ended up causing something worse, or you may. So self-compassion would override a decision like that, because you have to ensure that you are well. Then you are able to give effective compassion to your clients, your institution, and your colleagues. I hope that helped.
Any other member on the panel want to make a contribution?
Regarding this question from a nursing administration point of view, that was the latter part of my presentation that was missed. I referred to Mary Seacole, who was another pioneer who suffered, and I remember there's our Mary Seacole, we had a play and she was a Mary Seacole. Yes. And she was another pioneer who worked hard and went through struggles and much difficulty, and she didn't give up because she had that compassion, she had that empathy. However, she fought like Florence Nightingale. She went through the challenges similar to Florence Nightingale. But the history told us that finally the British government saw her performance and she was honored. And that brings me back to, we as nurses, we give and we give and we give. But as nursing administration, which I am a part of, we have to get to the point where we recognize the performance of the individuals, we recognize how much they have given, and we allow them time to rest and to honor them and to recognize and appreciate them. So that is how I see the balance can be struck, where nursing administration should take the responsibility to make the observation where they see the nurse now needs her moment. The nurse now needs some rest. The nurse now needs to be recognized and appreciated. So that is how I see from the nursing administration point of view. As the British government recognized Mary Seacole and honored her, I think the nursing fraternity, the likes of me, should recognize nurses and we should appreciate them. Thank you.
So I think that is an excellent question, because from a mother's perspective, sometimes we forget while we are going through our own struggles at the hospital that nurses are human beings as well. And sometimes they are tired, sometimes they're overwhelmed, sometimes they're overworked. And these are things patients or people that are going through, you know, the different emotions at the hospital tend to forget. So I think it goes both ways, and we have to remember that nurses, they also need compassion. And sometimes a simple thank you or a simple understanding that the nurses, they are managing a lot of patients, and we just have to be, patient and understand. So from a mother's perspective, we understand that nurses are human beings, and we just have to be more compassionate as well. Thank you.
Please let me just add to that. I will look at it also from a different angle as well. You cannot pour from an empty cup. You certainly cannot give what you don't have. And that's where emotional intelligence comes into play. The ability to recognize your emotions and that of others, and how your emotion is going to affect somebody else. And recognizing that you need to take a step back as much as you want to help, but knowing that helping at that point in time is not going to give your best and cause any harm. You need to take a step back. And your colleagues, they are supposed to be your support system. So when we have empathetic nurses, when we have nurses who are compassionate, they will recognize that that colleague of theirs, that individual is going through something, and I need to step in at that point. I need to support them. So my colleague, take a break. Take a break. Go on this side, and I will address that individual need. I will do that particular task or assignment for you. Because at the end of the day, there is no I in teamwork. There should be unity across the board. And when we are observant, not just of our clients, but when we are observant of our very own colleagues, when we have the best interests of each other at heart, we will pick up the subtle signs, you will notice that nurse is not as active as she used to be. That nurse looks a little far, you understand? She's a little reserved. That's not the bubbly person that I'm accustomed of working to. And when you pick up those cues, you realize that that nurse may just be going through something, because we all go through things at different points in our lives. And we step in to render that support and that assistance. But it's important as well for you as the individual to realize that if I do it, I may just cause more harm than good. And I'm not being selfish if I cannot do it at that point in time. Thank you.
In terms of what Nurse George said, that's the angle I was going to take it. However, even on a daily basis, being on the ward as nurses, when I go in, for example, as infection control officer doing wrongs, I would say, nurse, did you have time to take a break? Did you drink some water? Did you go to the washroom? Nurse, you are not doing CPR, So sometimes really you have to stop and take care of yourself. And this is what I was going to say in terms of the team approach. If you as a nurse, you burnt out, or if you as a nurse, something is wrong, you need to take a pause, a step back, so then your colleague could step in. Yep, that's great. Thank you for that, nurse.
You are going to speak on that same point, Robert? Okay.
Good evening, everyone. And to the panelists, I want to say great presentations. I really enjoyed it, very enlightening and moving. And very moving. Mrs. Rochling-Ford, just before you presented, I wrote down some points toward that exact topic, self-compassion. And with the question that you asked, in any setting, there must be somebody, like what she said, you have to pause. You stop, right? That's the first thing you said, stop. You cannot leave the person without the help, but there must be somebody you can send that person to. So referral. Because you don't leave the person without assistance. You don't leave them empty-handed. You still want to help them, but you cannot. So your next action would be, who else? And then you refer them to that person. Because you don't leave them without the help. But you also have to preserve yourself. So that's what I wanted to add to what you were saying. Yes.
To the panelists, I came and I did not know one person, but I know the one person now. And continue looking about Zion, because when I used to supervise in the Princess Margaret Hospital, I used to tell them, I hate that place. But I always think, so are you helping God to finish make children? Very good, very good. And that is one place I do not like to work there, but I admire the people who work there from the time the nursery got opened. So kudos and thanks for saying what we do that other persons don't see. Because sometimes as parents, we can be very disgusting when people are doing things for us that we do not understand. To the other panelists, thank you all very much for staying the course, because 69 years is a lot of time. And I have been there for not the 69, but for plenty times. From a student nurse on the Student Nurses Association into Dominica Nurses Association, and I am not going anywhere. I'm the de facto president all the time. Mignon Roll, one of the persons I tried, an ex-president like me. Thank you very much. You hit what I wanted to comment on, but I want to add. Because there is something about, Miss Carbon, sweeter, self-care and who you are. Self-management. You cannot be compassionate if you do not care about you. And you have to prepare to care about you. We all have stressors. We cannot live without it. It is a motivating factor for a lot of us to have challenges. But you can manage your challenge. And my experience, the patients are not normally troublesome or disgusting. The next of kin and the relatives are the persons who really do things to you, and we didn't mention it. So we have to be able to manage those people and give them enough information that they will understand where we are going. Especially when people bring elderly and children to the health centers and to the hospital, let us not, as nurses, ignore them or figure that because they can stay long, they can stay. We have to do better than we are presently doing. If we do not, we will turn and it will be on us. We will be on the receiving end of that lack of compassionate care. But one of the things, our socialization also helps to motivate us to do things better, better, and better every time. Ms. George, Mr. Husband, do not hold me to ransom. I can't see that. Any nurse or any human being that doesn't evaluate their day cannot improve. You must evaluate what you have done with your husband, with your children, with the people you socialize with. And my last point, to all the nurses out there, we need to have a camaraderie, that caring for yourself and caring for another person that you will see when your colleague is in need. You will see. They wouldn't have to ask, they wouldn't have to say. We have a lot of social things going on, and sometimes we even forgetting to call a colleague we didn't see, or that was a little funny at work, or said something that we could not answer at the time when we were at work, but we can answer when we get home. We have to care for each other. and we have to do things together. Stop saying not me. And what the Dominican Nurses Association is doing, Dominican Nurses Association must be doing something very good for the last 69 years. We're going to share love. We're going to continue to care for people. And younger persons, do not get work so that when you all get like the elderly, you'll be tired when you go to Roseau. Tired of people greeting you, not you greeting them, but they greeting you. And one thing I don't like them to tell me, you all were the nurses. Yeah. That has hurt my heart, because I know that I have tried 20 years trying to tell people, show people how to talk to people, how to deal with them, what to do. So please do not make them let them say the same thing about the younger persons. These are our gems, these are our jewels, and they are good. We just have to support each other. Older help younger. Older listen to younger, because they have some ideas and some suggestions that we can use to improve, and that we will never stop growing no matter how old we get. To the Dominican Nurses Association, I say, let us continue no matter what. You know how many of us that are in here? You know how many nurses that are in here? Anybody guess now? I have
55.
price to give. How many?
55.
What?
55.
120.
Okay. Good night to everyone. Okay. Good night to everyone. All right. Nurse Joan Smith. Well, maybe I should say retired, even if I look young, right? Yeah, but I've retired over 14 years. Being an RN with my colleague here, Nurse Etty right there, at the Nurse James. And I worked with her, well, she was part of my batchmate, and she's my batchmate. And then I came across her today, and I said I have to be here tonight. I'm very big on compassion, empathy. Matter of fact, when I worked here, they used to say, Nurse Smith, she spoiled the patient and the relative. But I say when it comes to my patient, I don't mess on the relatives. Even the doctor, even when the doctor is on ward, on the rounds, I respect the doctor. We work together. But the patient is coming in. You know, they have a relative, maybe a relative all the way from, let's say, Cassie Bruce or anywhere, and has to see their patient, the relative. What is it? When they go in, even now that the time is, when in terms of being very busy, and the nurses haven't got much time, and we have a lot of complaints about that now. They can help. They're not going to make noise on the ward. They can help. Give a bedpan. They can help. So I'm big on compassion. So with this, Ms. Ola, this is a topic I like, and I take a lot of blows for that, but I don't care. All right? Continue to exercise compassion. Do your work with pride, with dignity. Just do it and do it well. As Nurse Linton just said, nobody is saying like, you're hearing it, and I hear it all the time. Nurse, you already nurses over there. In fact, I heard a radio program the other day, and I was so disappointed. And I felt so hurt at home, and I'm saying to my sons, I have 5 boys. And I'm saying to them, I feel so bad. And they say, Mom, when you were there, you did well. Everybody know that. So it's okay. I said, no, that's my colleagues, my nursing colleagues. Please do yours best. Because you hear what the lady spoke about with her little son, Zion? I worked at the nursery as well. And my entire round at the hospital, I worked different places. My end was the intensive care unit, because I'm intensive care trained. Okay, I love nursing. I have a passion. I'm still doing it. Dr. Ola would know. I have private patients. I practice privately. And all my patients love me. They love me. Please do it. Nursing is a great profession. I'm still in it. So please do what you have to do. So, and just on this role, an extension to a question. Nurses are burnt out, okay? I know that's a lot of work. when you work on wards like Glover, a casualty. As a matter of fact, over 14 years, as I said, I have retired, and I got a message on my phone 2 days ago asking to come in for a session at the casualty, and I'm like, so my question is, but I was going just to my garden at the moment, I couldn't come to the casualty. The question is, what is it in terms of, are you short-staffed? Because, that cannot be, you need nursing care. What is just a question, is it that you're short-staffed but I realize we have a mass migration. We can't prevent people from going, but I still believe, I'm an advocate for that as well, to have your nurses stay here. In fact, I spoke to the Minister of Health, because Dominica, as I said, Dominica nurses are well-trained, very well-trained. I can give my life for that, because I was well-trained and I know they are. When they go out, they do very well. So I don't know, maybe in your conversations when you go maybe to the government level, negotiate for your nurses. Whatever way you can. Ask them whatever it takes, because everybody don't want to go. But people say, oh goodness, what are you doing here? Dominica's a paradise. I love Dominica. I'm not going anywhere. So there are a lot of nurses that want to stay here, but do something that they can stay. And all of your people are leaving, brain trade is not good. So if when you go out, in your commitment, in your passion, your speaking, see what you can do to keep your nurses here. Because our nurses here, we need our brains here. Okay? So if you have to negotiate, if it's in allowances or whatever, put your request forward so that we can have our nurses right here because they are well trained. Okay? Thank you very much.
Thank you. You want to respond? You want to respond? It was just a comment. Comment. Yes. Mm-hmm. Yes. Yes.
Okay, I just wanted to leave a few messages that came to mind when I was preparing for this lecture. Preparation is also compassion. Do we know that? So as professional nurses, if we do not, and I heard one of the panelists spoke about it, empower self-education, lifelong learning, that is not having compassion for ourselves. Because if you are in the clinical areas or whatever area in the district and you do not have the knowledge or the information about something, what is it going to do? It's going to frustrate you. And that frustration going to cause you to treat the client badly. Okay? So, continuous education, lifelong learning is very important in terms of self-compassion. Right? Now to the messages. No, not that I was going to say. So, empathy connects us to the patient, and compassion moves us to action. So compassion is an action word. All right? So I want you to remember that. Also, in terms of compassion and nursing identity, nursing is fundamentally a human-centered profession. Compassion influences how nurses communicate, what you say to the patient. You know we have a serious issue with that. We're speaking truthful, right? All you know I like truth. How patients experience care, trust between the nurse and the patient dignity, treatment adherence, patient satisfaction, relationship with families. That's what Nurse Smith just spoke about. Team relationships. I'm going to say that again. Team relationships. How compassionate are you with your colleagues in relation to your supervisor, supervisor to subordinates? The reputation of the nursing profession. And two last things. Compassion is not an extra skill. It is part of professional nursing competence.
Wow. Okay, so we're going to bring this.
Good night, everyone. This is not a question per se. I would just like to, first of all, Veronica Nicholas, president of the Dominica Dementia Foundation. Sitting here tonight, I actually enjoyed some of the key points that were mentioned as it relates to compassion. And one of those points that stuck with me is self-care or self-compassion, because you need to have compassion for yourself for you to be able to have compassion for others. And I can actually speak to that because I cared for my own mom, and I also started caring for someone else in the interim, and I realized at one point when I could not give anymore because I guess in a way I was completely overwhelmed, right? It's the best way to put it. And if I had taken time to care for myself, and I remember persons telling me that, but I didn't understand it. And at the time, I couldn't see how I could take care of myself. My focus was on my mother. I needed to focus on my mom, care for my mom. It drained me, and persons around me told me so, right? But there are other caretakers or caregivers out there who probably go through the same thing. So hearing these words, I wish we had more caregivers here, and I probably would like the caregivers for themselves to get these words, because they need it. When they provide care to others as well, they get lost, right? And they need to be reminded of these things. So I want to say thank you for sharing these words, and I'm looking forward to hopefully some relationship in the future. Okay, thank you.
Yes, but I want to make a bold request. Could we, because there is something we kind of mentioned, but we didn't give it any force. You see supplies? I'm going to say them simple. Needle, different size, syringe, equipment. Could we find some way that we as a nurses association talking about compassion, sit down and find a way that we can make the major employer of the state do something about the supply that we get to work, because the lack of supplies messing up all compassion, all everything somebody teach you, and you do not have the specific equipment, or you are always short on supplies and having to run here to find this, to find that, it affects your function. So if we as an association can do something, Piano, I hope you're still there and you're listening, because we really need to do something about the supplies that we get to work.
Thank you.
So just a comment towards the compassion of care. We've mentioned, hospital settings and so forth, district level. Currently, I would say I am at the Dominica State Prison. I'm the nurse for there. And in all my 17 years of nursing, if I did not have the instillment of being compassionate, to be there, you will not survive. Okay? Every day I set foot in the prisons, I have to always exercise compassion. Sometimes you get, the judgments of this place, and at the end of the day, there is one person that has to see them different, that don't see their crimes, don't see their faults, and it's always the nurse, right? You still have to exercise the care. You still have to treat, irrespective of anything. So definitely, I would definitely push for and encourage my colleagues that we need to care more We need to show that we care. Sometimes we have to be selfless because, you know, as I say, in the environment that I am, you have to be selfless. Sometimes I tell myself, I don't want to know your crime. But sometimes the social media points the crime. But that doesn't change anything for me. I still have to show that I care. I'm very happy that the Prison Association is there as well. That's my team. So I'm the only nurse, but I'm surrounded by mighty men. Okay? And they know I care, right? Okay, that's my contribution.
Okay, thank you, Ms. Timothy. Thank you to all our participants, all those who asked a question. Who could have thought that one question could spark so many different comments from every different angle? Right, so as we conclude, one truth stands out clearly. Compassion is not an accessory to nursing. It is the very foundation of nursing. It is the thread that binds the science to humanity, skill to service, and care to healing. Our discussion tonight reminds us that nursing identity is defined not only by what we do, but how we do it, with empathy, dignity, and unwavering compassion. May we carry this forward as both our professional hallmark and our collective responsibility. And to quote, Nurse Shillingford, we do not forget the person who's standing behind the care. So let's see how we can turn the tide within our profession as we continue to grow ourselves and grow the service. Thank you, and we now call on Nurse Loda to give us a vote of thanks.
Good evening, everyone. As we bring this memorable evening to a close, it is my great pleasure on behalf of the Dominican Nurses Association to extend our heartfelt gratitude to everyone who contributed to the success of our anniversary panel discussion held under the theme, Compassion, Defining Nursing Identity, and our discussion topic, Compassion as Core Competence, How Empathy Defines Nursing Identity. Tonight has reminded us that compassion, or complete passion, is not simply a quality we possess. It is the very foundation of who we are as nurses and how we make the patients and relatives feel. Not forgetting ourselves, self-compassion. We cannot give care if we don't have self-compassion. Through and through, the thoughtful insights shared by our panelists and the meaningful engagement of our audience, we have been challenged, inspired, and encouraged to continue placing empathy at the heart of patient care. So this evening, we gratefully acknowledge Dr. Olagunju, Director of Primary Healthcare. Your leadership and commitment continue to strengthen healthcare delivery throughout Dominica. We thank you. A special thank you goes out to our distinguished panelists. Mrs. Yvonne Carbon, Principal Nursing Officer, Sister Deborah Roach Philip, Nursing Manager, Nurse Malina Ola, Community Health Nurse, Mrs. Mignon Roll Shillingford, Nurse Educator and Coordinator of Health Promotion Unit, and Mrs. Diane Stout Abraham, our patient representative. Thank you for sharing your professional knowledge, personal experiences, and unique perspectives. Your openness and passion enriched our discussion and reminded us that compassion remains nurses' greatest strength. To our moderator and the president of the Association of Dominica Midwives, Ifelja Rainer James, thank you for expertly guiding this discussion with professionalism, warmth, and excellence, ensuring every voice was heard and every perspective valued. We also extend sincere appreciation to our valued partners and invited organizations. President of the Council of Aging, Mr. Nigel Lawrence, and members of the Council, Sergeant David Andrew and the Dominica Police Welfare Association, Mr. Naya Winston, and members of the Dominica Prison Service Welfare Association, President of Dominica Diabetes Association, Ms. Antonia Samuel, and other members, President of Dominica Dementia Association, Ms. Veron. Thank you for standing with us as advocates for health and community wellness. To our past and present presidents of Dominica Nursing Association and the executive members, thank you for your vision, leadership, and dedication over the years. Your work has laid the strong foundation upon which we continue to build. To my fellow members of the Dominica Nursing Association, thank you for your commitment, professionalism, and willingness to serve. Together, we truly embody our motto, United we serve. Our appreciation also extends to the staff of GIS for helping us share this important event with the nation. Honorable Kasani Laville, who is not here this evening, and Kyrie FM for your sponsorship and media coverage. Mr. Peter and the IT staff of the Dominica Hospital Authority for ensuring the smooth technical execution of tonight's event. The DNA Fundraising Committee and DNA Education Committee for the countless hours of planning and preparation. Nurse Michaela St. Rose, whose contribution is sincerely appreciated. To our generous sponsors and partners, thank you for believing in our mission and helping make this event possible. GLAM, Dawn's Catering Services, Do It Center, Jolly's Pharmacy, Malcolm Stevens and Son, Issa Trading, Perky's Pizza, Mrs. Charlene James Graham, Nurse Anne Princess Laville, Mrs. Denise Edwards, Nurse Renetta Toulon, Sister Ophelia Linton. Your generosity and partnership are deeply appreciated. Finally, to every nurse, healthcare professional, educator, supporter, and guest who joined us this evening, thank you for your participation and engagement. Your presence demonstrates our shared commitment to advancing compassionate, patient-centered care throughout Dominica. As we live tonight, let us carry forward the message that compassion is more than kindness. It is a professional responsibility, a leadership quality, and the defining characteristics of nursing. May we continue to serve with empathy, integrity, excellence, and unwavering dedication. Thank you once again for making this panel discussion a tremendous success. May God continue to bless each and every one of you, the Dominican Nursing Association, and our beautiful nation. Thank you.
And so we bring the curtains down on this broadcast. As we bring the broadcast to a close, we take this opportunity to recognize and congratulate the Nurses Association, which is celebrating its 69th anniversary this year. The association was established on August 22nd, 1957, marking nearly 7 decades of service to the nursing profession and to the people of Dominica. Let's just listen to an announcement being made by Nurse Joanna before we wrap up.
Going to the Caribbean Nursing Organization Conference, where we'll be selling Dominica, because the 35th biennial nursing conference will be in Dominica, where we're going to have almost 400 nurses. So come support us, come on board. We love you. Thank you for being with us. God bless.
Okay, so we again were saying thanks to the organizers of this event. We want to congratulate the Dominican Nurses Association on the 69th anniversary. It was founded or established on the 22nd of August 1957, marking nearly 7 decades of service to the nursing profession and to the people of Dominica. It was also founded by pioneering Dominican nurses, including the late Sister Elsie Dubik, the association's first president, with the nurse with Nurse Elaine Pringle among those who served on its board. And for 60 years, the Dominican Nurses Association has played an important role in advancing the nursing profession, advocating for nurses, promoting professional development, and contributing to the improvement of healthcare delivery in Dominica. And as healthcare continues to evolve, the role of the nurses remain absolutely critical. From the bedside to the communities, nurses are often among the first, and we want to congratulate them for a well done job. So, once again, congratulations to the Dominican Nurses Association on its 69 years of service, commitment, advocacy, and professional excellence here in Dominica. From all of us here at Kyrie FM, we extend our best wishes to the association, its leadership, its members, retired nurses, and the nursing students. Happy 60th anniversary to the DNA. And to Honorable Kasani Laville and the DNA, thanks for sponsoring the broadcast. Thanks to our chief technician, Yipman Bruno, ably assisted by Guston Drago. I am Steve Vidal, taking it back to Master Control. Just a quick reminder, there is no Real Talk tonight. Enjoy the rest of your evening. Good night, everyone.